What does beetroot extract actually do for men's health? Is beetroot extract worth the hype? And what does the science really say? Let's take an honest look at the evidence. More men are reaching for beetroot extract supplements, and it's easy to see why. The claims around heart health, energy, and performance are everywhere, but let's separate fact from marketing. Beetroot extract comes from Beta vulgaris, the humble beetroot, in a concentrated form. You'll find it as a powder, capsule, or liquid. What makes it interesting from a health perspective is its high content of dietary nitrates and compounds called betalains, which are pigmented antioxidants. Here's how it works. When you consume those dietary nitrates, bacteria in your mouth help convert them into nitric oxide, a signaling molecule that causes blood vessels to widen. That widening improves blood flow and helps oxygen reach your tissues more efficiently. That's the core mechanism behind most of the potential benefits. So what might those benefits actually be? Research suggests beetroot extract may offer modest support for cardiovascular function, including a small but meaningful reduction in blood pressure. It's worth being clear. This isn't a dramatic effect, and it certainly doesn't replace any prescribed treatment. For exercise, the evidence is more consistent. Research suggests beetroot extract may improve endurance performance in moderate intensity activities by a small margin. There's a reasonable body of evidence supporting that use among active men. There's also interest in the betalain antioxidants and their potential role in cellular health. However, claims around prostate health or erectile function are not well supported by current evidence. The science simply isn't there yet to draw firm conclusions in those areas. Now, an important point. In the UK, beetroot extract is sold as a food supplement. It is not regulated as a medicine by the MHRA and has not been evaluated for treating any specific medical condition. That distinction really matters. It's also worth knowing that nitrate content can vary significantly between products, so effects may differ depending on what you're using. If you're considering beetroot extract, speak to your GP or pharmacist first. They can help you choose a reputable product and give you personalized guidance on how and when to use it. Please don't self-prescribe a specific dose or regimen. Research protocols vary, and what's right for you depends on your individual health circumstances. There are also some important safety considerations. If you have low blood pressure, or if you take blood pressure medication or anything containing nitrates, speak to your GP or pharmacist before use. There may be interactions to consider. People with a history of kidney stones should also check with their doctor first, as beetroot extract contains oxalates. One side effect worth knowing about, and it's completely harmless, is beeturia. That's when your urine or stools take on a reddish or pink colour. It can be alarming if you're not expecting it, but it's simply the pigment from the beetroot passing through your system. If you have persistently high blood pressure, heart concerns, or any ongoing health condition, please speak to your GP rather than relying on a supplement. And if you notice any unexpected symptoms after starting beetroot extract, contact a healthcare professional. So to recap, beetroot extract works by boosting nitric oxide production, which may support blood flow and cardiovascular function. Research suggests it may offer modest benefits for exercise endurance and blood pressure. It's a food supplement in the UK, not a licensed medicine, and it's not a substitute for medical treatment. Always speak to a healthcare professional before starting, especially if you have any existing health conditions or take other medications. Have you tried beetroot extract, or are you curious about it? Drop your questions in the comments below. If you found this helpful, give it a like and subscribe to Bolt Pharmacy for more evidence-based health content.